Good evening, everyone, and welcome. I'm coming to you on behalf of the European region of World Physiotherapy, which I have the privilege of chairing. My name is Esther-Mary Darcy, and I want to welcome all of you to this webinar tonight. We've over the last few years had a series of webinars for all of our colleagues throughout Europe and indeed well beyond Europe. And this evening's one in the series is Physiotherapist for Mental Health, the skills you have and the impact you can make. I think it's a very exciting title. And this comes from one of our working groups. We have three working groups on professional practice, education and research, and advocacy and EU matters. And then we have two thematic working groups, one on cancer care and the one on mental health. So tonight we have the mental health group who are here and who are going to speak to you, and Petra will introduce all of them, but I would just like to in advance thank all of them. Katri Partanen from the executive from Finland is the chair, and we have Cristina Bravo from Spain, we have Tine Van Damme from Belgium, and we have Didzis Rozenbergs from Latvia, and we have Petra Dubajová from Slovakia. So thank you in advance to all of them, and I'm really looking forward to this. It's an exciting title, and I hope all of you will enjoy it. And there will be time at the end for lots of questions and engagement from the audience. So hand over to you, Petra.
I would like to welcome all the colleagues that are joining us. And without losing much time, I will introduce part one of our webinar called Competencies All Physiotherapists Should Have. And it is held by Didzis Rozenbergs, which is a member of Mental Health Working Group of the Europe region of World Physiotherapy and junior lecturer in rehabilitation in Riga Stradins University.
The main purpose of today's webinar is to promote active involvement of all physiotherapists in Europe and beyond in treatment and management of the most common mental health disorders. So this is not about specific severe diseases, but it's main problems people face in today's life, so anxiety and depression problems, thus helping patients regain their full functioning and quality of life much more quicker than without physiotherapists. So I sincerely hope that after this webinar you will be able to list some physiotherapy competencies crucial to help people with mental health problems. This is my part. I hope you will be able to give examples of how physiotherapy can help people with mental health problems, and you will be able to list some tools and resources available to all physiotherapists for effective work with people with mental health problems. So these are our objectives today. I hope we will reach them nice and clean. Okay, competencies all physiotherapists should have. So this is from some kind of paper perspective. Let's see. This part is based on guidance document prepared by Education's Matter Working Group from European region. It was published in 2022, and the title of this guidance document is Expected Minimum Competencies for Entry-Level Physiotherapists in Europe region. So this is not specific to mental health. This is overall knowledge we expect every physiotherapist to be able to show competencies. So let's start with assessment competencies. The first thing we should know that every physiotherapist should be able to demonstrate appropriate background knowledge of normal and impaired human functioning regarding all the ICF components of International Classification of Functioning Components. Thus, what is meant by this is that every physiotherapist should be able to recognize when people's functioning are changed, impaired, and not working as it should be, thus being able to start investigate what is the problem. The next one is every physiotherapist should be able to retrieve relevant information from available sources. So every physiotherapist should be capable of going through medical records and to recognize information in there, as well as every physiotherapist should be able to perform an anamnesis, so retrieve relevant information from patient and or patient assistants or caretakers, and as well as to perform a physical examination based on ICF assessment criteria. And so every physiotherapist should be able to appropriately screen for serious underlying pathologies. We know that every physiotherapist are well trained to recognize red flags regarding back pain, and we know that some of the red flags are closely related to psychosocial factors. So we know that in mental health, the red flags are a bit different than in back pain situation, but inquiry into psychosocial factors is the same thing. So every physiotherapist should be able to point attention towards psychosocial factors as uncovering possible red flags for mental health problems. And every physiotherapist should be able to use clinical reasoning skills to agree on appropriate goals through shared decision making with patients. So clinical reasoning will be the keyword for here, that would tie assessment competencies to diagnostic competencies, which is one, to interpret and evaluate assessment findings and to provide physiotherapy diagnosis. So we see that all physiotherapists should be able to use their knowledge to recognize impairment and to give explanation regarding the causes and the effects. Okay, let's move on to the next competencies, intervention competencies. So every physiotherapist should be able to plan an appropriate intervention program with SMART-based goals, considering individual expressed preferences, beliefs, and choices. While we recognize the importance of SMART goals, we also recognize the limitations of this approach, and we are looking forward for all physiotherapists to be able to use both SMART goals and open goals when planning appropriate intervention, and when necessary to use these approaches interchangeably. We also know that every physiotherapist should be able to advise and enable patients regarding norms of physical activities, sleep, and diet. As we know, these norms are universal. There are no different norms for people with mental health disorders. So the same information applied a bit different settings, maybe by giving a bit more time, but the result should be the same. Again, every physiotherapist should be able to communicate in clear, structured, and succinct manner, just to be sure that the information is well understood. Every physiotherapist should be provide holistic approach to patient management to achieve meaningful objectives at the activity and participation level. And every physiotherapist should be able to implement a safe and effective intervention. And there's nothing else to add here, just safe and effective intervention, human rights for all our patients. So this is about intervention competencies. And so now let's move on to professional and interprofessional health promotion and prevention competencies. So regarding professional and interprofessional competencies, one is being aware of one's own role and role of others within multi-professional team. As we can imagine, physiotherapy is not almighty. There's no situation where physiotherapist alone can deal with everything. So being part of multi-professional team is crucial, thus not shying away of our own competencies and giving all we can At the same time, being aware of our own limitations of knowledge and skills. And this is also universal. Every setting where physiotherapists go, whether it's musculoskeletal system, women's health, cancer, and stuff like that, being aware of our limitations and knowledge and skills is important to both stop when it's need to stop and to move on with further education, lifelong education. Regarding health promotion and prevention, the first one is to empower patients to facilitate change in health behavior through motivational interviewing and implementation of self-management strategies. So motivational interviewing is skills to learn, but it's very useful when dealing with motivation issues, which is not only part of classical mental health field, which is problem worldwide, and use by a psychosocial approach. This is something I have already mentioned in previous slides. So not only paying attention to physical factors, but to see human being as a whole. Okay, and let's make a conclusion. In conclusion, role of physiotherapists are to ask the patient about psychosocial function. So physiotherapists should work on developing the attitude where direct questions are part of routine work, questions about cognitive, social, interpersonal functioning, well-being, whatever. Second one is to screen for most common mental health challenges. So it is well known that relying only on your own opinion and on your own impression is not enough. So we recommend to use standardized assessment screening tools for screening of anxiety and depression. To screen for lifestyle factors with focus on physical activity levels. So when we are facing people with mental health issues, we should check what are their physical activity levels and how does it in fact affect their lives, and be able to identify red flags to support decision making and referral to mental health specialists. As mentioned previously, we are not alone here. We should know our boundaries and we should know where to ask for help and where to go for cooperation.
So the next speaker will be Cristina Bravo. She is also a member of Mental Health Working Group of the Europe region of World Physiotherapy, and she's also a professor in physiotherapy in mental health at the Leida University. The part 2 helps the name tools and physiotherapists can have.
As physiotherapists, we are trained to focus on the body, how it moves, how it functions, and how to help it recover from injury or dysfunction. Our main tools are movement, touch, posture, breath, and between others, but the impact of our work doesn't stop at the physical level. Function is closely related to physical structure, or muscles, joints, and nervous systems, but it is ultimately directed by the mind. Every movement we make, whether voluntary or unconscious, is initiated and coordinated by the brain. In this way, function is not just a mechanical outcome, it's a dynamic expression of mental intention, emotional state, and neurological control. Movement becomes the bridge between body and mind, allowing the internal world of thoughts and emotions to manifest through posture, gesture, and action. This is why working through movement gives us access not only to the body mechanics, but also to the person's psychological and emotional reality. What happens in the body affects the mind. What happens in the mind affects the body. This is especially true when we work with people who are dealing with mental health challenges such as anxiety and depression, trauma, or stress. For example, when someone is tenses, their muscles might tense up, their breathing becomes shallow, and their posture may collapse inward. These physical patterns can reinforce the emotional state. As physiotherapy, we can intervene by helping the person become aware of the body, release tension, improve their breathing, and recover a sense of grounding through movement. These changes in the body can support changes in the emotional and mental states. So while our standing point is the body, our therapeutic goals can reach further to support mental balance, emotional regulation, and holistic well-being. In this sense, physiotherapy is not just about fixing a shoulder or a back. It can also be about helping someone feel safe in their own body. Again, reconnect with themselves and regain confidence in their daily life. This broader perspective allows us to be part of an interdisciplinary mental health approach, where our unique contribution is grounded in the intelligence of the body and the healing power of movement. Interviewing skills are essential for physiotherapists, not only to collect medical anamnesis, but also to understand the person behind the symptoms. Through reflective and empathetic questioning, we can gather valuable information about a patient's interests, preference, motivations, and personal beliefs. This process allows us to explore their readiness for change and tailor our approach to meet them where they are, both physically and psychologically. Effective interviewing helps build trust, encourage collaboration, and supports the design of interventions that are meaningful and sustainable for each individual. These interviewing tools also allows us to identify risk factors and warning signs of our patients. By listening carefully and asking the right questions, we can detect uses that may not be immediately visible through physical assessments alone. For example, a patient who reports chronic pain along with feelings of hopelessness, social withdrawal, or sleep disturbance may be showing early signs of depression. Recognizing these indicators enables us to refer appropriately and intervene early, ensuring a more holistic and effective approach to care. Some of the most common red flags are social withdrawal, significant decrease in functioning, problems with memory, attention, concentration, big change in energy levels, feelings of hopelessness, suicidal thinking, disobedience, excessive neglect of personal appearance, substance abuse, dangerous or illegal seeking behavior, and others we are training for detected. Okay. That effective interpersonal communication establishes the basis for a good therapeutic relationship with the patients. That kind of relationships is essential for collaborative setting therapy goals and tasks, build trust and rapport, delivering appropriate therapeutic interventions such as patient education, health promotion, and other therapeutic interventions. Good communication ensures that the patient feels heard, understood, and actively involved in their treatment, which is especially important in mental health, where emotional and psychological factors play a key role. By communicating clearly and empathetically, the therapist helps the patients feel support, increasing adherence to therapy and improve outcomes. As a physiotherapist, our knowledge of neurophysiology, stress, pain mechanisms, neuroplasticity, therapeutic exercise, human psychology, and the health benefits of movement allow us to deliver more effective and meaningful interventions. When we understand how these systems interact, we can better explain these functions in a way that patients can relate to and understand. This not only helps reduce fear and confusion, but also empowers the persons with knowledge and practical tools for change. Educating patients with clarity and confidence improves their engagement, supports self-regulation, and promotes long-term well-being. In this sense, our role goes beyond treatment. We become facilitators of awareness, motivation, and transformation. We don't just treat the body, we empower the minds. For example, when a patient with anxiety says, "My pain never improves," we can explain your nervous system is stuck and overdrive, amplifying discomfort. The good news, gentle movement and breathing exercise can help retrain this response. This science-based education does more than inform. It transforms the patients. Patient shifts from feeling helpless to understanding their body's capacity to change. They learn not just the why behind their symptoms, but the how to move, how to self-regulate, and how to actively participate in the recovery. And in mental health, that shifts is everything. As physiotherapy, we do more than assess physical symptoms such as pain, dysfunction, and movement limitations. We also explore the personal histories behind those symptoms to understand the full context of which they appear. This includes identifying biopsychosocial factors such as emotional stress, social environment, beliefs, and coping strategies that may influence the patient's conditions. By doing so, we can better understand their level of motivation and anticipate potential barriers to adherence. This approach is especially important when working with patients experiencing depression or anxiety, where physical complaints often coexist with emotional and cognitive challenge. Addressing the person as a whole allows us to design more personalized, realistic, and effective treatment plans. That's why we examine 3 key layers: their movement patterns, what they can do physically, their mental drivers, what they believe they can do, their emotional worries, what's holding them back. Therapeutic exercise is one of the most powerful tools we have in physiotherapy for supporting mental health. There is strong and growing evidence that regular, structured physical activity can significantly improve symptoms of anxiety, depression, addiction, eating disorders, schizophrenia, and other mental health conditions. Exercise influences brain chemistry, reduces stress hormones, promotes neuroplasticity, and improves sleep, all of which play a crucial role in emotional regulation and cognitive function. Beyond its impact on mental health, exercise also enhances physical well-being, energy levels, and overall quality of life. It empowers individuals to reconnect with their bodies, regain a sense of agency, and experience positive change through actions. When used intentionally and adapted to the needs and capacities of each person, therapeutic exercise becomes a safe, accessible, and transformative resource in the process toward recovery. Among the different types of physical activity, aerobic and resistant training at moderate intensity have shown the strongest evidence as effective adjuncts to antidepressant treatments. These modalities not only help reduce symptoms of depression and anxiety, but also enhance the overall efficacy of pharmacological and psychological interventions. When integrated into a multidisciplinary approach, therapeutic exercise provides a safe, low-cost, and empowering strategy to support recovery and long-term mental health. For last, body awareness techniques are essential in physiotherapy for mental health. Body-oriented therapeutic approach using a holistic perspective directly towards awareness of how the body is used. This practice, such as yoga, tai chi, qigong, vivat, and nourishing psychomotor physiotherapy, breathing techniques, help individuals reconnect with their bodies and a safe and mindful way. In many people experience anxiety, depression, trauma, or dissociation, the body can feel unfamiliar, tense, or even threatening. By gentle attentions to body sensations, we support emotional regulation, reduce stress, and promote a sense of presence and safety. Developing body awareness empowers patients to notice patterns, recognize early warning signs, and take an active role in their daily process. It's not just about moving, it's about feeling, sensing, and regaining trust in the body.
And now I would like to ask Tine Van Damme, member of Mental Health Working Group of the Europe Region of Physiotherapy and an assistant professor at KU Leuven in the Department of Rehabilitation Sciences, to present the impact of physiotherapists can make.
Okay, good evening or morning or whatever to you. So the final part of this webinar, I'll try to outline a little bit what the impact is we can have as physiotherapists, and not only physios specialized in mental health care, but actually all physios. So we saw it quickly in the poll already. We tend to see physical and mental health as two different or separate entities, and it's typically also managed that way in healthcare. So we have general hospitals and we have psychiatric hospitals, for instance. And with this few slides, I'll try to show you why it's so important to recognize that physical and mental health are actually very much connected to one another, and it's very difficult to set them completely apart. So, for instance, if you have a physical injury, illness, or disability, this can severely impact your mental health, but also in the other way around. If you have mental health issues, the way your rehabilitation will go will be impacted by your mental health status. So that's important to take that into account. So, for instance, poor mental health will impact your rehabilitation process, so the therapies you're giving, but also the outcome. And especially, and we've heard it a few times before, anxiety and depression symptoms, the most common mental health challenges we see in clinical practice, will impact our rehabilitation program, especially in terms of compliance, but also dropout rates and even prognosis. Also, another important thing to take into account, I think not many people know that, but is that if you have mental health issues, your perception of what is going on physically, or if you get mental health related information explained to you, people might process it in a different way. So it's always important to take that into account and to check also the mental health status of our patients to see if they understood everything and if they have any remaining questions. To just briefly give some examples here, if we take a look at patients who are entering cardiac rehabilitation, which is typically a somatic issue, a physical issue, we see that 28% of them show significant symptoms of anxiety. About 13% of them show significant stress-related symptoms, and even 18% show moderate levels of depression, which is quite a high number. It's 1 out of 5. Also, in this study, what is seen there is that those people entering cardiac rehabilitation, those with mental health symptoms, are much less likely or significantly less likely to adhere actually to their rehabilitation program when we compare them to those patients without mental health issues. So it is relevant to question, to ask, to see if there are any mental health issues present and if they need to be treated, and not just focus only on the physical aspects. So I was talking about chronic low back pain patients, and if you look into research looking at moderators of pain and also moderators of disability, we see actually quite important factors coming up that are mostly related to mental health issues, I think. So such as fear avoidance, for instance, kinesiophobia, so fear of movement, avoiding to move, but also again depression, and you will see it coming back a few times, and also catastrophizing, so the way people think about their pain and the impact that pain might have. And the last one on this part is actually on the barriers to treatment. So I've mentioned briefly that if someone has mental health issues, this will impact the adherence to physiotherapy as well. And if you look at the most common barriers, you can see that some of the barriers are situated at more physical levels, such as low physical activity at baseline or at the start of physiotherapy, but also the lack of social support. But the most important ones are also in the mental health field. So low self-efficacy, again, depression and anxiety and hopelessness are actually important barriers to adherence to our physiotherapeutic interventions. And so it's important to take that with you. Okay, go to the next one, please. So final part and the impact of physiotherapy on mental health, I'll explain quite briefly. So it's mentioned before as well that especially as physiotherapists, we have important tools we can use. And one of the most important and also the most robust evidence is available for physical activity and exercise. And if we look at stress reduction, we see that physical activity and exercise can significantly reduce the stress our patients are encountering. And that way we can promote relaxation, which in turn will improve the mental well-being. So stress reduction is actually a very important part of what we can contribute to in patients who have mental health issues. The next one is sleep. So it's also fundamental next to exercise for stress reduction. Sleep is very important. And again, we see that exercise as well as physiotherapy can improve the quality of our sleep and that it is essential for health in general, but also for mental health. So I put it in brackets because you should know this as a physiotherapist, how important it is to get qualitative sleep, not only for mental health, but also for physical, to restore your physical functions. So we see that restorative sleep is also closely linked, not only to physical health, but also emotional well-being and overall mental health. And I think you can align with that if you yourself have had a few bad nights of sleep, then you tend to be less able to regulate all your emotions and so on. So it will impact your emotional well-being as well. Okay. In terms of mind-body connection, and I would argue that including aspects from mindfulness and relaxation in your physiotherapy practice can be very important. Why? Because we see quite a lot of patients who have difficulty with getting into touch with their body, connecting to their body. And we know that mindfulness and relaxation can really help to promote that body-mind connection and in turn, again, help managing stress and anxiety, which in turn, again, can improve emotional well-being. Yes. And as I said, it will come up a few times. Anxiety and depression management, I think, is amongst other things, but I think this is the most common and most important aspect to bear in mind when treating patients because of the high prevalence. So again, here we see that exercise can really, as I said, there's really robust evidence to support mental health by exercise and physical activity. So we see improvements in mood, reductions in anxiety, and also impacting self-esteem in patients with mental health problems. Also for chronic conditions, which might be of interest to also many of you, I can assume. Chronic conditions really often impact the level of participation, the level of or amount of activities that people engage in. And in the long run, it really can increase their risk for mental health deterioration. On the other hand, we see that with physiotherapy, we can improve the physical function of our patients and alongside helping them to cope with more psychological aspects of a chronic condition. So in turn, you can see that the arrows go both ways. So by improving physical function, we also help our patients to engage a bit more in and participate also at community level. Yes. And then finally, I think it's the final one or the final one for body representation. Again, as I said, many of our patients can struggle with body representation, bodies, and self-esteem. We know that physiotherapy can help with that, again, through improving the physical functioning and promoting the self-perception. Also, the mind-body connection can be improved by physiotherapy by, for instance, really putting the body under physical load. It can increase the proprioceptive cues, but also the interoceptive cues, which can help to get a better or more accurate body perception in that way. Yes. And then finally, leading to self-confidence and self-efficacy. For instance, again, I'm in the world of exercise, but we know, for instance, that if we set goals for physical fitness goals, and achieving those goals through physiotherapy can create a sense of achievement and increase the motivation. And we also know that when these physical activity interventions is actually offered by a professional, someone in the field who has knowledge on exercise, physical fitness, but also mental health, that it's much more likely that people will be engaged in the therapy, and we will see less dropout. So in turn, achieving those goals, increasing the motivation, will impact the self-confidence and self-efficacy as well. And I think that was the last one. No, not yet. Sorry. Yes, this is definitely this one. So not everywhere it's possible to do group-based physiotherapy interventions, but what we see, if we can offer group-based therapy sessions, actually it provides our patients with opportunities for social interaction and also support, and which can be very important aspect of what we do is this social engagement. Again, many people struggle with feelings of isolation and loneliness, and it can be important to combat those feelings by having a place where you can interact and get some support, which in turn, of course, can again lead to better mental health.
In what ways can we as physiotherapists approach the referral of an individual to mental health services with respect, sensitivity, and professionalism?
It's not an easy answer because there's no right or wrong. I would like to start with like, at least try to get into the conversation, try to check how it is with the patient, how they're feeling, if they recognize what you are telling them, because every situation is different. So there's like no right answer to it. But in my opinion, a lot of physios are a bit afraid to ask questions on mental health. And actually, it's only when we ask those questions that people will actually start talking about it, and it will work as taking the stigma away. Of course, you need to do it within your own boundaries of your own skills, because if you do not feel comfortable, your patients will pick up on that as well. But I think a genuine question like, okay, I am actually quite concerned about your mental health, can be a good start to just have that conversation and see what is going on. That would be my first reflection on it. But please, I'm looking at my colleagues as well to elaborate.
Yes. I would like to continue that my first idea after reading this question is the same way we approach any other human being. So if the person is here and we are here, and the person who's asking for our help, we are here to help. So respect, sensitivity, and professionalism, the same as Tina told you already. Just being open, being patient, letting people talk if they are talking. If they are shy, just giving space, giving time, and being, I'm not sure the brave is the correct word, but just being direct about what you are inquiring and not being shy about what's happening. Okay, being reflective. I guess it would help.
Considering the positive impact of physiotherapy on both physical and holistic well-being, to what extent are we as physiotherapists competent to use standardized scientific instruments in research related to the mental health effects of physiotherapeutic treatment? Or is it necessary to collaborate with a mental health professional?
I would go with the answer that it depends on the tool you are using. Does the tool need specific training? And if yes, are you able to do that training? Also, I would say it depends on specific research. If the question is about research, it depends on the research. How many people are in your research team, and what is your role in this project? I believe the most tools are easy to train to use, and they're quite applicable in physiotherapy setting. That would be my answer.
I think also that tools are often quite easy to administer, but are not always that easy to interpret. So I think if you administer a tool and you feel like you're not competent enough to like really give an interpretation to the outcome, then think about it in advance, because for your patient, if they have to like fill out tons of questionnaires and then we don't do anything with it in the process, that's also not really ethical. So in advance, think about, okay, what will this questionnaire or this tool serve the purpose of my treatment or my intervention? And then for research, I think it's like Didzis said, there are like different levels you need to be trained at. For therapeutic settings, I would say, yes, there will be a point where you need to work together with the mental health specialist. And that's, I think, also not the message we want to give here today, that you can work with severe mental illness in any case. And that's the case for us as mental health physios as well. We need to work with other mental health professionals. But up to a certain level, you can do a lot. And I think many physios are often a bit, I don't know, insecure or not confident enough to do what they actually can do with this population. And that's a bit the message of today. Yeah, we usually use the JAD tune, or that's a very brief screening tool. And recently we had some publications on that tool as well. You can find them. They're open source on how to screen actually for anxiety and depression in different populations, ranging from fibromyalgia to chronic pain. And then the PHQ, the 9 or the 2 version, it's only 2 items. It's actually very good sensitivity. So these are tools that definitely can be used by a physiotherapist. And yeah, it's just 2 questions, so why not? It's a screening only, yeah. So it's actually to see if you need to explore it further or refer to a mental health specialist.
What studies has to have a physiotherapist to treat patients with mental health?
To what level do you need to be educated? Well, there are huge differences between countries, whether it's included in the bachelor's, in the master's of physiotherapy curriculum. So as I said, we just had a global survey actually with the IOPTMH, and there we see actually that in many physiotherapy curricula it is included, but more in a theoretical form, not so much in a clinical experience. But there are even a lot of countries who do have clinical internships in mental health services. Though surprising, we also looked at the confidence level of physiotherapists in working with patients with mental health problems. And there we saw that actually, whether or not it was included in the curriculum, that was not a very strong predictor. We saw that a lot of people who gained actually additional training specific in mental health, that was a very good predictor. So people feel more comfortable working with people with mental health issues if they followed any specific training. So the more general courses in physiotherapy education, I think they should be there, because for me it's basic knowledge. If you have pathology courses, why not have some pathology or mental health courses as well? I think it's very important, but that's just basic knowledge. And to work with patients with mental health issues, it depends on the setting where you're working at. I would say if you work in a general practice, having some notion on how to identify the red flags and to be aware of them, to ask, to have the attitude to ask, are you okay? I am concerned about you. You see depression symptoms, recognize those red flags. That's very important. If you work really in psychiatric or mental health care, then I think you need to have a more thorough understanding of mental health problems. And that needs a bit more specialization there. But it also has to do with the country you're working in now. So it's easy for me to say I work in Belgium. In Belgium, it's very well embedded in the curricula and in all hospitals, but it's not for every country that way. I know that a lot of colleagues are not even allowed to work in a psychiatric care, for instance. So yeah, there are huge differences, but I see also a lot of international colleagues who learn so much just by self-directed learning and following webinars and reading, and they are great therapists working with mental health patients. So why not?
There a question about any additional factors when working in pediatric setting with both caregivers and children?
I would say it depends on the problem, because in most cases, what we should take into consideration, the most job we have to do is with parents or caretakers of children. So, especially if it's about behavior, if we are part of team that works with children with behavior issues, a lot of work have to do with educating parents, including them into therapy, because children are not so good on using the skills they learn in therapy. If you're talking of preschool children, the skills they learn in therapy, they're not so good to apply them in other conditions. So if we want for them to change the behavior, we have to work with parents. That would be my short answer.
Thank you. Cristina or Tina, do you want to add anything there?
Maybe very briefly, we see for some interventions even that they're more efficacious when we work with parents than with children. For instance, if we look at mindfulness interventions for children with ADHD, it's better to train the parents in mindfulness than to train the child with ADHD. And that goes for most of our interventions, somewhat around up till the age of 13, 14. And then we see it's better to work with the adolescent. But especially for young children, it's either together with the parents or with the parents alone. But we see better results when we do it that way. Yeah.
Then there was just a question about some specific evidence-based interventions to improve sleep besides introducing adults to get 8 hours.
There's quite a lot on sleep, and especially for, again, for minors, it has to do with not only getting enough hours of sleep, but there's very well recognized that it's not the same for every person, that there are different rhythms in your sleep patterns, and some people need 8 hours and others don't need 8 at all. So some basic measures on sleep hygiene is very important to start off with, but also your behavior during the day. So being physically active enough, it's best not to do it just before going to bed, especially for those people who cannot sleep well, do not get to sleep easily. So it's important to be physically active enough during the day, but not too late in the evening. And then, of course, there are some dietary measures that are quite important, like caffeine intake and alcohol intake and so on, that will impact. So they're more like lifestyle advice you can give. In terms of interventions for us as physiotherapists, again, here I am with my relaxation and my mindfulness, but I think that's the intervention in our closest to our field that we use most often for patients who have problems sleeping. So I think it's a multimodal intervention. It's not just physio. We need other disciplines as well, but we do have an important role to play within that multimodal package. And it will depend on your patient, whether you need to work on more physical activity or relaxation exercises, or it's really like lifestyle habits that need to be changed. But in my opinion, most of the people with sleeping problems have a high level of stress and they cannot cope with it very well. And that's often why they are referred to us to help them out with that.
One more, which is possibly related, or maybe moving on to the next group from our pediatrics, but just a question about key points on working with young adults with anxiety.
Yeah, there are 2 things for anxiety. Physical activity, again, exercise is really important in this population. There's quite robust evidence indicating that it really can reduce symptoms of anxiety. What I would recommend from a clinical perspective is to really do it under a supervision of someone who is trained, because a lot of adolescents with anxiety are also very anxious about what they feel in their body when their heart rate goes up and So you really need to be there, and you need to prepare them that it's normal when your heart rate goes up and you go sweating and so on. But otherwise, they will get lost along the way. So you need to have to talk also on motivation and how to handle things. And again, I think teaching them brief exercises to manage their anxiety, just like breathing control exercises, is a very brief, easy to use things in daily practice is much more appropriate for young adolescents compared to like these long relaxation exercises where they need to lay down for 30 minutes. They prefer things that are quite hands-on and they can be used in the setting immediately. So don't go making it very complicated. Actually, it's quite the easier or the more simple, the better, let's say, for that population, I would say.
Here you can see the QR code where by scanning it you will find more information. There are a lot of documents, infographics, also earlier webinars. Here you can see some samples about those. And we have made infographics. So if you are interested to translate to your own language, please contact the Secretariat of Europe region. And there is also a briefing paper, Harnessing Physiotherapy Skills for Mental Health Solutions, a call for action in Europe. And this webinar was based on this briefing paper. So thank you all for joining us. There were people from so many countries. It was very nice to see that people were coming all over the world to join us. And thank you for working group for your hard work, and also for Secretariat for helping us to do this webinar. So thank you, and hope to see you again. Good night.